Good evening, everybody. It's always a pleasure to be here.
Okay.
Good evening, Mr. Bombasi. You're welcome. Every other person, please kindly reach out to your friends, reach out to your well wishers. Those of you that are members on our members platform, do a reminder so that others can join. We have a lot to talk about today. So let's not keep everybody hanging. We need to get this platform more engaging so that we can deliberate and have a fruitful deliberation. You're all welcome once again. I'm here with you. You're welcome.
Thank you so much, Dr. Mary Jane. I just believe you are still around. So please just help us to anchor this session on the next item, which is the goodwill message. Thank you so much.
You're welcome. Okay. You're all welcome to this month's meeting. And this meeting is very apt because today I was even expecting more persons. Let's reach out to people, please, so that we'll talk more. And somebody has made out time to prepare to talk to us on health awareness on prostate gland. It's important we get the place busy so that we can deliberate and we'll all learn something. You're all welcome. For our members here, our fellows here, welcome you. We'll just take out a little time for you to just give us a brief goodwill message. Once we do that, please do well to ensure ergonomic safety. If you are sitting in one position, whilst the meeting is going on, you can take a walk around, you can move your body, then ensure you have a glass of water beside you so you can take water on intervals. You're welcome. Mr. Kufa Suko, go ahead, sir.
Good evening, everybody.
Good evening, sir.
I'm most pleased to be part of the meeting today. I think this is my first virtual meeting. I'm grateful. The theme for the teaching that we'll be having was very, very captivating. I indicated interest and I shared it to friends and families. So I expect that it's going to be an engaging one. Thank you so much for putting this together. I appreciate it.
Thank you so much. Thank you for that wonderful input. You're welcome, and we hope to have you from time to time. On this platform, we deliberate, we learn, we leave it open for a lot of persons that have interest in safety awareness to come and learn. It's not like other platforms where you must be a member. Here, it used to be like that until we had to become liberal to allow others to come in and learn, because the issue of safety is everybody's business and everybody's concern. And we believe that the more persons that are safety aware, especially in Nigeria, the safer and more secured our nation will be. So you're welcome. Please do well to share the link to others to join. You're welcome, sir. Mr. Higgins, are you with us now?
Higgins is with you. I'm with you.
Go ahead. Just a brief good message from you will do, sir. Thank you.
Good evening, everybody.
Good evening.
Yeah, I want to let us know that safety is everyone's responsibilities. You are not only entitled to your personal safety, you're also entitled with the safety of those that are working around you, those that are also living with you in your home, those that are also with you in the vehicle. That is why if the driver is overspeeding, you have the right to tell him to run within the desired, the safe driving limits. I want us to also drive down safety to our children, no matter how little they are, because if they are not safe at home, we are not safe at work. Let's continue to preach safety. Thank you.
Thank you so much. Thank you, Mr. Higgins. Thank you for that. It's always a pleasure having you. You're always here. I appreciate your commitment. We appreciate your dedication to the cause of safety. We appreciate your quest for knowledge. You're always here. You're always making apt inputs. We appreciate you. Thank you so much, sir. I will start with Engineer Dr. Itwasa. Please go ahead. Your goodwill message. Thank you, sir. You're welcome.
Thank you, Dr. Mary Jane, and good evening to all my warm colleagues and friends of this noble association. It's a good thing for us to meet every month ending this way. This helps us to at least lend our voices to each other and then learn from each other from what we've always been learning in the course of our profession. Having said that, Today's lecture is going to be very, very interesting. Not just only interesting, but I know each and every one of us will learn and gain something from it because it is more direct to our health related to prostate. So I know the speaker will do a lot of justice and let all of us hold our pens and then our papers, and if it's a recording, we'll record properly so that we can gain one or two things from it. Having said that, I want to use this opportunity to say welcome and good evening to everybody. And I pray that as the cold is here, let all of us keep our body warm all the time, and so that we don't fall ill, and then we remain strong. So I wish everybody a happy deliberation and have a very good evening.
Dr. Kufre Essien, the chairman, OSHA UK, Akwa Ibom State Chapter. My boss, go ahead with your goodwill message. You're welcome, sir.
Yeah, thank you, Dr. Mary. Good evening, distinguished colleagues. I bring greetings from the good people of Akwa Ibom State. I'm happy to be part of this meeting today. I know today's meeting will be impact-loaded and result-oriented, considering the topic. And I want to welcome everybody. As usual, let's learn, let's share ideas, let's contribute. For us in Akwa Ibom State, we are getting stronger by the day. We are having endorsement from different organizations, different agencies of government, and we are planning for an event which maybe by the end of this month we're able to advertise it so that everybody will join us. So once again, I want to welcome everybody, and let's keep on learning. Let's keep on contributing our part. With all of us coming together, we're able to take safety to every doorstep. Thank you once again.
I want to call on my boss, the Executive Director, Engineer Dr. Emmanuel Walaka. Engineer, sir, you have the floor.
Yeah, this is to say a very big happy new month to all our distinguished members, distinguished fellows, our branch chairpersons and chairmen from various states in Nigeria. I bring you greetings from the United Kingdom. And I'm also rightly receiving the Nigerian chapter president. He just arrived in London this afternoon. So as we are saying, also talking, he won't be able to join this meeting. He have already passed that information to me. But I told him I would brace in because I'm actually on preparation for our Namibia conference holding from Tuesday next week. So we are all on the move and very busy at the moment. But I'm always delighted to be in this meeting to give my support always, and for us to always remain in the spirit of change that brings a way forward for the country, Nigeria at large. And I believe that we are the light in this profession. Looking at all I'm seeing in the country every day, a lot is happening in Nigeria, and everyone is crying for help. One of the easiest help is for people to have safety information, security information that can save their life. You see, so in this month of August, even as we are talking about health today, is a very interesting topic. In fact, this very issue of topic, I have not really understood what it's all about. So I'll be very delighted to learn from it. And also every other person here to be anticipating a lot of good news at the end of the day, a lot of learnings and a lot of impacts from what the lecture is going to provide. And for our new members who are joining us for the first time, you're highly welcome. And I say happy new month to you all. I'm very much standby, please. Thank you.
Biasness, I can see that we have health awareness on prostate gland, hospital Suleja, the person of. So, ladies and gentlemen, please put your electronic hands together as we welcome him to lead us through today's lecture. And we hope it's going to be a very wonderful one. Please keep your pen and your paper beside you so that you can learn. And whatever you learn today, ensure someone else learns it from you. You're all welcome. Doctor, you have the floor, sir. Dr. Ibeabuchi, please go ahead, sir.
Hello, do you hear me?
Better. We can hear you now,
okay.
sir. Yes, I can hear you now.
All
Sir. Go
right.
ahead,
Good
sir.
evening, everybody. I'm so happy to be among you this evening. Men of caliber, all types of professionals are gathered to hear this information. It's very pleasant to hear the goodwill messages that have been going on. I thank you all for the opportunity to share with you concerning health. The topic today is health awareness on prostate gland. Are you hearing me? Hello?
Yes, we can hear you.
Okay.
We are with you, sir.
I don't know whether I can't produce the slides here. I've sent it. If they can use it, present it there, that would be okay. I sent the slides to, but I don't know how to present it here. So, but the main topic is health awareness. And the outline is going to be, we talk about the structure of the prostate gland, the functions, the diseases that are associated with them, and which includes BPH, prostatitis, and prostate cancer. But we'll dwell more on the prostate cancer. And when we talk about the prostate is an accessory organ. If you people have done biology, some of you know what I mean by organ. It's an accessory gland that is of the male reproductive system. It's a very small organ that is situated below the bladder and weighs about 25 to 30 grams. And the size is about 20 mil. We usually measure it in mil, measuring about 3 cm by 4 cm. It's a male organ, and it sits between the bladder and the rectum. The rectum is where people pass their stool, from where the stool is passed. Stool, that means feces, gets to the anus and gets out of the body. The prostate has connection with the urethra. The urethra passes directly through the center of the prostate. And that part of the urethra is called the prostatic urethra. And it has some issues, which we will understand later concerning the prostate. For practical purposes, the prostate is divided into zones, histologically described in zones. It is surrounded by an elastic fibromuscular capsule. Fibromuscular simply means it has muscles. Muscles do contractions. And fibro means it's hardened, it's strong. And the muscles, what they do when they contract, they tend to compress things. It is glandular. Glandular means it produces some glands that the body needs, chemicals that the body needs to function. Difference which connects, we pick sperm cells from the testis into passing through the prostate into the urethra. The urethra is from where urine and sperm passes through. And the prostate, because of the position of the prostate and the pipe through which urine passes, which is called the urethra, any enlargement of the prostate may have some effects on the urethra. It can constrict it. What I mean is narrow the pipe and make urination difficult. The zones of the prostate will help us to understand some of the diseases, the functions of the prostate. The prostate acts as a mechanical switch between urination and ejaculation. Ejaculation means when you reach orgasm, when you are having sexual uh, you're having sex with somebody and you reach orgasm. Orgasm means you reach climax. There is ejaculation. And that ejaculation releases sperm and semen. And is mainly driven by the muscle system running along the prostatic urethra. The prostate itself helps to move, disconnect the urine when the sperm is going, and also helps to disconnect. It's like a switch. When the sperm wants to come out, the prostate will stop urine from coming out. When urine wants to come out, the prostate will block the sperm from joining it. So at that, you can see the zones may be difficult. You see that you have the peripheral zone, which is the one that is very, very close to the rectum. The rectum is the anus side, when you put your hand inside the anus. The thing that takes things to the anus is called the rectum. I'm using language that everybody will understand. Not all of us are biology students and medical people. So if you look at that diagram, you can see the anterior means the front of the person. Posterior means the back side. And the rectum and the anus are behind the testis and the penis, through which urine passes. So posterior means back, anterior means front. This is the right side and the left side. Those arrows are pointing towards us. So it will help us to understand the diagram. You'll find out that the peripheral zone actually is behind, more behind than the front. And the transitional zone is the one that surrounds the urethra, which is the place where if there's a problem, there I can constrict it more. And these are the major two zones that are very relevant to our study. We'll move to the functions again. Then the prostate contributes to the semen, contributes about 30% of the seminal fluid by the seminal vesicle, which we saw on the slide. But it contributes about 30%. That 30% contains a lot of things that help the prostate to run where the cells to run where. The prostatic fluid is alkaline. That thing that it produces is alkaline. The urine is acidic. So the urethra is always acidic. So what does the prostate gland do? It produces fluid that actually neutralizes the acidity of that passage through which the sperm will go through. And this will help to protect the sperm from damage. It helps to prolong the life of the sperm because the sperm has a long distance to move. For it to be very useful, it has to pass through the vagina, which is like a war front. It has a lot of things inside that place which are not good to normal, small cells like that, very young cells like that. They may damage them. So it helps to protect it and makes the sperm cells to live longer, helps their vitality, and protects them from damaging their genetic code. Genetic code is something that actually makes us to look like what we are. The muscles of the prostate is like a pump that helps to propel and push the sperm into the urethra and outward. So those muscles, as I said earlier, it contains smooth muscles and fibrous tissue and glands. And the muscles also surround the urethra. So when there is ejaculation, when it reaches orgasm, it helps to push these things out. It also contains some enzymes that help to produce what they call dihydrotestosterone, which is the active form of testosterone. It's a male hormone that makes a man to look like a real man, helps all the male functions of a man. That is testosterone. So it helps to metabolize it and make it to be active. So it has a lot of functions. The prostate is a very important organ in the human body. And prostate helps us to sustain ourselves so that we don't get extinct, as it helps to protect the sperm and help us to produce younger ones. Now we go to the diseases. The diseases, we mentioned BPH, which is benign prostatic hyperplasia, which simply means, in simple language, just enlargement of the prostate. And then you have prostatitis, which means inflammation. And then you have prostate cancer. Inflammation means, when it is infected or attacked by toxins. Then the next slide talks about, we go to the BPH, which is a benign prostatic hyperplasia, which is enlargement due to increase in the number of cells that make up the prostate. That is the meaning of hyperplasia, from a cause that is not cancer. What it means is that this increase in number of cells and enlargement is still under control. It's still under regulation, so that it just keeps growing, but it will not grow out of limits. And this BPH is usually found in the transition zone. That transition zone is the one that surrounds the urethra. So when it gets large, and it grows very slowly, when it gets large, it can block the urethra. The transition zone grows slowly through, yes. It obstructs the urethra, yes, and can cause urinary retention. Urinary retention means you want to pass it, you won't be able to pass it. And you'll find it difficult. And there could be backflow. And when there's backflow of urine, it can go to the kidneys, because the kidney produces the urine. And when it produces that urine, it is stored in the bladder. The reason why God made it like that is that when it's stored, you find a convenient time and place, then you can empty your bladder. It is stored in the bladder so that you can discharge it at your convenience. If not, one will be dribbling with urine all the time. And urine is not a good thing. It smells. So when that place is blocked, the urine can go back due to pressure and creates undue pressure in the kidney. This may lead to what they call hydronephrosis. And the hydronephrosis, if it's persistent in chronic cases, can damage the cells of the kidney. And the kidney is a very important organ in the body that controls, removes, and regulates both the blood pressure, the bone capacity. The kidney does a lot of work. It also helps to remove all types of poisonous materials, and helps to remove some things that are produced elsewhere that the body does not need, even the one that the body has produced that they don't need. So when they accumulate, they can damage the brain and damage other organs. That will be multiple organ failure. And the result is something that is not pleasant to hear. The symptoms of BPH, for you to notice that you have BPH, the symptoms come with frequency of urination. You notice that person will begin to go to urinate frequently. Frequently. Sometimes very small volume. Sometimes you feel that the urine has not finished. Sometimes you want to urinate, it will not come. Then sometimes when you want to urinate, before you prepare yourself to go and urinate, you pour it out. That is what is called urgency. Sometimes you won't even know when the urine will come out because it is around the urethra. So all its symptoms are concentrated around that urethra. It can lead to pain when urinating because when it stays too long, the process of trying to force the urine, the undue pressure around that place may start creating issues. Sometimes there is blood in the urine and or semen. The treatment for BPH is not a life-threatening something. The treatment is you can take medications or the prostate can be removed by surgery, or they can create a channel through it by some medical procedures. They just pass something into the urethra and remove some of the prostate the part of it. And sometimes you can pass a catheter if it's difficult urgently. Catheter means something to relieve somebody of this thing. I actually, for something else is involved here, which I didn't mention. The prostate is sitting on the pelvic floor, and the pelvic floor can affect erection and potency. The pelvic floor can, if it's not in proper coordination and agreement with the prostate and the urethra, they may cause erectile dysfunction. Then let's go to prostatitis. Prostatitis is inflammation of the prostate gland. Inflammation means, the way you will understand is similar to swelling, but the organ is disorganized somehow. It's like when you have a burn on your skin, the way it looks is part of it, or somebody hit you, and the body swells up. That is what is called inflammation. It can be caused by infection with bacteria or other non-infective causes like poisonous substances that enter that place and can lead to symptoms. Some viruses can also cause that. The symptoms are similar, but specifically, person may have fever, that is hotness of the body, painful urination, painful ejaculation, growing pain, difficulty passing urine, fever, tiredness, and feeling unwell. Can also lead to erectile dysfunction. Treatment is with antibiotics mainly and anti-inflammatory drugs. Anti-inflammatory drugs, you go to the hospital, the doctors will know what to do. When you have such symptoms, please try and go to the hospital. We are going to prostate cancer. Prostate cancer is when there is abnormal growth of cells in the prostate gland. The cells grow both in size and number, and they lose control. They grow, divide without regulation. They don't agree with the body regulatory system that tells them, yes, it's time to reduce your growth. It's time. We know when somebody grows up, people have their heights. The body tells you that it's time to stop growing. And every organ, there's a regulatory system that tells them it is time to stop growing. But in cancer situation, they don't understand that language. There is distortion in the genetic code, which makes them to misunderstand the regulatory system. And the thing continues to grow. And when it continues to grow, it begins to attack neighboring organs. Like the prostate is situated under the bladder. it begins to attack the surrounding tissues. And this thing usually happens at the peripheral zone, which is very close to the rectum. And the bones are around that place will begin to attack all of them. Everything that is around there begin to penetrate them. And when these things are penetrating those things, the neighbors, they begin to create problems. And those problems are not they are not good because it's a change in the environment. And when the environment is changed, they lose function. And when they begin to lose function, the body begins to misunderstand each other. And some of the cells can enter into the blood and travel to places. And anywhere they go, they will continue to grow there. So when some of them enter the brain, they begin to grow and they can create pressure inside the head. They go to the bone, they create pressure. They go to the joints, they create pressure. So since the bones are very close to that place, some of the symptoms include hip pain, back pain, waist pain, difficulty in urination, difficulty in passage to very bloody urine and bloody ejaculation, because it's tearing vessels and blood vessels, nerves, and all those things. They compress the nerves, causing pain. So all these compressive things are the things that cause the problem. It is a peripheral zone, and that peripheral zone is behind, very close to the rectum. That is why one of the major tests we do is to put hand into the rectum. You put your hand into the rectum, you'll be able to determine the nature of the prostate, because once put hand in the rectum, you are going directly at the surface of the peripheral zone of the prostate. So we need to actually go, when they tell you they want to do your rectal examination, it's called rectal examination. Do not be shy. Please try and present yourself comfortably. There are risk factors. The risk factors we need to know is that the prostate gland some part of the prostate gland continues to grow very slowly. And at the age of 50, it has grown enough to show us if there is a developing problem in that place. So most times the prostate keeps growing, and some parts grow to for life. They continue to grow. And that part is the part that is concerned with the BPH. The other sides are not expected to continue growing. So age, the older one is, the more likely is to develop prostate problems. Then hereditary factors, there are some genetic things that are involved. Some people are genetically predisposed to have the cancer. If somebody has relations who have had cancer, you have to check yourself regularly to see whether you have it. They are more likely to have cancer if it is occurring in the family. They say some some races have more cancer than others. They say black people from African origin, they have it most, and is least among the Asians. So the white people, the Caucasians have more than the Asians, and the blacks have more than the Europeans and the Caucasians. Then fats, especially animal fats. Research has shown that those who eat a lot of it are likely to have or have more chances of having the prostate cancer. And general lifestyle behaviors like sedentary lifestyle, obesity, excessive alcohol intake, smoking, and carelessness with your sex life can also create problems. And those who avoid sex due to one reason or the other, one religious reason or the other, or one reason or the other, they don't have sex regularly, they are also likely to have prostate cancer. As we said earlier in the diagnosis, we will use a digital rectal examination, which I have mentioned earlier. We'll take the blood and check what they call PSA, which is protein produced by the prostate gland. It's called PSA, prostate specific antigen. It's produced by the prostate gland. There's a level it will reach. The doctors will begin to say, yes, it is very suspicious, and we have to do more investigations. Ultrasound is also very useful. The ultrasound will show us the structure and the nature of the prostate. They have different nature, the structure, the architecture will change. The capsule means this, the covering layer of the prostate will show some difference. And even the internal structure will show some differences. And that makes it very, very suspicious. But the definite diagnosis is made from biopsy. You pick something from the prostate, send it to histopathology. They use a microscope, analyze it. They will not tell us definitely this is cancer. Another way clinically we can also suspect it highly is when it has spread to other organs and the size. PSA can be elevated in other conditions. Anything that harasses the prostate. Sometimes BPH is slightly elevated. Elevated means raised. Prostatitis, massaging. Just after orgasm, the PSA will go up a bit. So it can be deceptive. So one has to know when to go to check your PSA. When you finish making love early in the morning and you run to the hospital to check your PSA, it may be very deceptive and frighten you unnecessarily. When there's injury to the prostate and when it is compressed, it can also increase the PSA, but usually it will not be to a very high level. What concerns us now is to actually know when and how to go for screening, how to check ourselves. Because prostate cancer may not actually present with symptoms. Prostate cancer may not present with symptoms, and is the one that is most deadly and does not present with symptoms most of the time. But when it presents with symptoms, the symptoms are similar to that of BPH and prostatitis. But they hardly present. They begin to present their symptoms when it is getting late, when it has started spreading and beginning to compress the neighboring organs. So it is good to regularly go for screening. And the screening is recommended once somebody is above 50, some people say 55 years, some say 50. Once you are 50 years and above, or 55 years and above, it's good to always go to the hospital and screen yourself for prostate cancer. The commonest way accepted all over the world is to check the level of the PSA. That will give us an idea because it's very simple. Just collect the blood and run it in the lab, and they'll give you the result instantly. Doesn't take long, and it's not invasive. It's not something that doesn't require surgical or disturbing somebody or wasting time. So when you get to that age, it's better to regular at least once in a year. At least once in a year. You can do it twice in a year, but it's recommended to do it once in a year. But for we Africans, since they say people from African ancestral origin have more cases of even more aggressive cancers, they recommend they do their checkup or screening from the age of 40 years and above. Recommended that you yearly go and check your PSA. And those who are, their relatives have, those who have high risk factor, relatives or relations have prostate, they should also, by age of 40, should also try to check themselves. Even your extended family members have it, please always go and check your prostate, especially lower level at 40 years and above. The second method of screening is through digital rectal examination. But we do that when we have done the PSA because it's very discomforting to put hand into somebody's anus. So when the PSA has shown that we can come, the doctor will now put his hand into the anus to check. Do the digital means your hand, your finger, rectal examination. And then the third one is ultrasonography, ultrasound. When we check through the ultrasound, we know it can tell us a lot about the prostate. And it's also discomforting because the most reliable ultrasound to assess the prostate is through the rectum. We also pass through the anus to look at the prostate. The prostate cancer is one of the leading cancers among men, solid cancers. And they estimated sometime that every man that is up to 100 years, at 100 years, that is about 100%. Everybody will have cancer, but that was then. Now that we have realized some of the reasons why they come, I think the statistics will drop. In prevention, we have to look at something. There are areas that we can do nothing about. If you go to slide 18, it tells us that there are things you cannot change. It happens in older age, the race and the genes. There's nothing you can do about it. That is how you have found yourself. Everybody will continue to grow older. You can't change your race, neither your genetic makeup. But some of the things that will help us is when we control some of our lifestyle habits, eat healthy diet, the general things that reduce diseases, improve our immunity. Because when the immunity is also down, we have cells in the body. We call them soldier cells in the body that help to attack anything that is abnormal, any foreign behavior, any behavior that is not expected in the body. Those cells go and attack it and destroy it and organize it. So those killer cells of the body, soldier cells. There are habits that suppress them. They also attack cancer cells because the cancer behavior is abnormal. So the general behavior of well-being will affect the prevention of prostate cancer. So we eat good food, enough vegetables. They say whole grains. In fact, some studies say green tea and other materials that they advertise, some of them are true, but they are not being properly verified. They say that some of them, when they take it, they check the PSA level, it drops. So there are some things like they recorded after research, meat that's been burnt. They say it's charred meat. All those meat that people go burn on the stake and eat it anyhow. I think it's the soot that is causing the problem. The animal fats, many of us like those. And we would like to go and eat fatty food. We enjoy it a lot. And some of these things, they are not good to the body. Not only prostate, they also create problems in other parts of our body. We should learn to do exercise. Exercise is very, very important. In fact, I rate it as one of the most important parts in controlling this prostate cancer. When people start getting older, they seem to drop from doing exercise. And when you do exercise, especially the one they call Kegel's exercise that strengthens the muscles of the pelvis, what does it do? It helps to increase the blood supply to that area because the prostate is situated in the pelvis. It helps to control those muscles of the pelvis, and those muscles of the pelvis help us to get the blood supply. The prostate blood supply also helps to control diseases and supply all the cells that will help to control the attack cancer cells. Those defensive cells of the body, when they have enough blood supply and nutrients, it helps them to control the problem. Exercise is very, very important in controlling the cancer. I'm sorry I digress. It's just because of my data at current is changing. I need to update it. We need to avoid smoking. Smoking reduces immunity. We need to increase especially vitamin D. That time they had COVID. Most people who are sportsmen interacted with themselves in the field. They played soccer together, they mixed together. Most of them didn't collect that COVID. And it made me to start thinking that both exercise and vitamin D, which we get directly from the sun, and from research has proven to improve our condition and especially reduce the incidence of diseases, including prostate cancer. And also, the research has shown that those who are sexually very active are unlikely to have prostate cancer. Sexually active means they have to be involved in sex. And sex is not just, let's say, once in a month. They say it has to be at least 2 to 3 times a week. And as men get older, most times their spouse get weaker. And they found out that these things are contributing a lot to the development of this cancer. The prostate gland has association with what they call growth hormone. The growth hormone is produced by the seminal vesicle, which is very close in association with the prostate. I feel that the growth hormone, maybe if it's stored for too long, the excess of it is what is telling this prostate to start growing anyhow. And it suppresses the regulatory hormones that try to stop it. When one is far more than the other, they may start telling the prostate to continue growing because the suppressor hormones are not there. Some of the drugs that help to suppress BPH also, when taken for a long time, they say those who take it are likely to have prostate cancer. When you have idea that you may be having problems with your prostate, the problems you may develop is anxiety because of what we hear about the prostate. Anxiety is one of them. People are talking about prostate everywhere. So any little symptom somebody has, you'll be filled with anxiety. The best thing to do is, where do you get your help? Go to the hospital. When you go to the hospital, you are likely, the doctors there will guide you properly and tell you what to do. That is where the discussion ends. Thank you for listening.
Good evening, all. Doctor, thank you for that wonderful presentation. I'm very, very much happy. I've learned a lot in this lecture. I just have one question. My question, I couldn't see the slide very well. You said about red wine. Is here one of contributing factors to prostate enlargement or what? That's my question.
Yeah, the red wine, they've done an investigation and said moderate intake of red wine is beneficial to the whole body. It helps to improve immunity and helps to improve the efficacy of antioxidants. So,
okay, moderate of it, moderate, not too much of it.
Don't take too much. Yeah, when you take too much, the alcohol intake has become. If you drink too much water, you start feeling uncomfortable. Is it not so?
Yeah, that's true.
Yeah.
Okay, doctor. Sorry. Again, sometimes when there's cold, I don't know whether is only on my own side. When I was only cold, I always urinate frequently when there's much cold. When the weather is very cold.
Yes, it's natural because the bladder has a physiological capacity. So when it reaches that, in normal situation, when it reaches that capacity, what does it do? It will like you to void the urine. And during cold weather, the body, all the areas that we lose water are not functioning well any longer because they are trying to constrict it. The sweating drops. So we lose a lot of water from sweating. Dehydration drops because the environment is not, the evaporation from the body has dropped. The latent heat of evaporation has dropped. So everything about the losing of water has dropped. So everybody tends to urinate more because once you reach the physiological capacity of the bladder will tell you to go and void. And, usually we take water, and most times people are advised to take water regularly. And the quantity of water we are expected to take is affected by the weather. So if the weather is cold, you drink much water, you go to urinate frequently. It is natural. But that is why during cold weather, please don't drink too much water in the evening. I hear some people on social media, they are telling people, drink a lot of water. When you want to go to bed, drink water. It's not good to drink water when you want to go to bed because it will disturb your sleep. And sleep is very, very vital for good health. Well, women don't have prostate. What they have is kidneys gland. It originates from the place that prostate originates. That is what makes women is situated just under the introitus, just at the anterior side. Anterior means the front side of the orifice. And it helps to lubricate that place when you are stimulated. When you are stimulated, it becomes very wet so that the joystick can easily make its journey without injury. It's called the kidney gland, but it's not the prostate, but they originate from the same source. And they do similar job.
Okay, so next time you talk to us on that. Today is for the men, prostate glands. Okay, yes. Can we have more questions, please?
Like as many as most of us, let me just say it like that. Most of us that sometimes we're away, maybe to work, maybe offshore for 2-3 weeks. What is your advice to enable us to at least meet up like what we discussed today concerning to help us on that prostate reduction?
Offshore. You go offshore.
I say like most of us that are here.
Oh, in what sense?
No, as in your spouse.
Oh, when you lose that. Well, the research they didn't do it with those that have spouse as well only. Because they try to do the research, this in science, we try to, all of us here are scientists now almost. You have to be critical without bias. So there are people that do ejaculation even without a spouse. And those people, they found out that they ejaculate and the rate of cancer from them is very, very low. So that ejaculation is very important. I am not to advise you to go in irresponsible acts. But if that is, maybe you ask, footballers are paid very heavily because of the short time they have to play and the risks that are involved. Maybe you ask your workers to put it into consideration and increase your money so that you know and you check yourself regularly. If there's any sign of it, please go and help yourself. But if you think you cannot do so, you masturbate. When you masturbate, if it agrees with your religion, it's okay. If it does not agree, don't do it too. Because religion is very important.
So differentiate between prostate cancer and hernia.
Oh, they are not related. Hernia is totally different from prostate cancer. Hernia is where there is a defect in the body and the internal covering of the body, and then the abdominal contents begin to push out from there. They are not supposed to push out to be seen under the skin. So when they pass the layer that's covering the place and then begin to appear under the skin, directly under the skin, we call it subcutaneous tissues. Then it becomes hernia. Hernia can occur anywhere. It can occur in the abdomen, can occur in the upper abdomen, the lower abdomen, can happen around the navel. It can also happen around the groin, if you know what is groin. It happens there. And in men, sometimes it enters the scrotum. And then you differentiate it from hydrocele, which is different from hernia. There are two different things, but the scrotum will swell up. But in hernia, you'll be able to push it back. They are different. Prostate does not show any swelling anywhere.
But I would like to say that with such a lecture, everyone, the time, there should be enough time for questionings, because this is a very critical aspect in our life, especially with the male. like it, take it or leave it, we would one way or the other encounter it, if not by us, by those related to us. So having said that, my question is related to the last one you read from the chat box. I used to hear they say either hernia or prostate has a relation to when you do hard work. So maybe, thank God we have the doctor here. He could give us a clarity on that. How does hard work affect one to have either prostate or hernia? Also bearing in mind also that they said those riding on bike, like keke riders, like motorcycle riders, they are prone to have either of these. I don't know. Doctor, please, we'll be happy if you can clarify this.
Yeah, the prostate, as I said earlier, is lying on the pelvic muscles. The pelvic muscles are directly under, just in between the, surrounding the anus and the scrotum area. So when people sit, they sit on that place.
Okay.
Yeah, when they sit on that place, it compresses that place. It can damage, it can, create damage there and increase the PSA.
Okay.
It's not that it causes it causes any disease of the prostate. It can only increase the PSA, unless by sitting on it so long, you compress it so much that the blood supplies is no longer adequate. You sit for too long, then what it means is that the nutrients that the prostate needs, it's not getting it, and that has to take a very long time. Then the prostate can develop all types of diseases. Then that of hernia with hard work, depends on the definition of hard work. What you're actually talking about is physical.
Correct.
Job.
Physical load, yes, correct.
Because the mental job is also hard work. So the physical thing is when there is too much application of muscles to, especially lifting of objects. Yes, and when people lift objects, if you touch their tummy, it's compressed. When people even pass hard stool, you see the tummy is compressed. So that compression of the tummy increases the intra-abdominal pressure. What I mean intra-abdominal, the pressure inside. Just like balloon, you try to use your hand to compress it. It will look for a way, the things inside will look for a way to escape. And then some people are genetically predisposed because some parts of their body are weak. So when such pressure is there, the weak side will give way. And those things will begin to protrude from that place. That is what is called hernia.
So it's not so advisable for riders, like people on the bike, to sit for too long because it has an effect for their PSA, correct?
Yes, especially if why we use bicycle especially is the bicycle seat is usually hard. And if you check the shape of the bicycle seat, it also takes only the position of the pelvis.
That's true.
It's different from the seat of the motorcycle.
Yeah.
Yes. The motorcycle seat is soft and wide. So the gluteus muscles or the buttocks takes much of the assault.
Okay. Thank you, Dr.
Bless you. Okay. Thank you once again. Please, my question is that during your talking, you do talk about the PSA, because I can remember the last time I did PSA, and there's another one they call the scan. After I did the PSA, which was the blood, I went for the scan where I drank water, and when I wanted to pee, I came in. So after they did the test and everything, the result came out that the PSA was very okay, either 2% or something. And the other one, the scan through, they said it was okay, but something is growing that I need to treat that. So they gave me a drug for that. So later I went so that maybe I can be doing the regular test as recommended once in a year. So, but the PSA is still okay. But the doctor said I need to be doing the scanning, the PSA and the scan. But they said the PSA is okay. And I said, no, that the two goes together. I wouldn't know. Is it Is it the PSA and the scan that has to be done?
Did you complain of any symptom?
There was one night that I pee 6 times overnight, so I was worried. But after that time, everything has done. I pee overnight 6 times, so I used the restroom 6 times. So I was worried. That's why I went to them. But after that time, I'm using all those things that subside. Maybe at times now 2 times, 3 times, maximum 4 times, but it's not regular.
Yes,
some of these things that you mentioned, at times I want to pee, it might be a small pee. At times it might come, at times I drink lots of water, so at times I might pee in a day, maybe 6 times, 5 times. So, but not much too. So, but every November I go for that PSA, and that's something, I do my test on prostate.
Thank you very much. Thank you very much.
Thank you.
The PSA, as we said earlier, if you check the slide, you see that they said it's the gold standard. Gold standard means it's the major thing to check. It's when it's high that we begin to do other investigations, especially if there's no symptom. What I mean by symptom, if there's no complaint. If the PSA is okay and there's no complaint concerning your urine and the rest of them, there's no need for the scan. But if there's a scanning machine, ultrasound scanning machine, and you enter the office, you say they want to, well, you can run a scan, you can check other organs. It's still okay. But if you have done the PSA, it's all right, and you don't have any reason to go to hospital for any sickness, you can just do the scan just to support the hospital and check other organs.
And thank you, Dr. Ibe. A few announcements and updates for us as we go home this evening. What we have here, first of all, we have the Namibia Oil and Gas Conference coming up on 12th to 15th of August. That is from Tuesday to Friday of August, Friday next week. So we hope that some of us will be there to also participate. Of course, very importantly, I know that our own engineer Dr. Emmanuel will be there to also deliver a keynote speech. And then coming up towards the end of the month, we have the National OSH Workshop 2025. And I'm very sure that we are aware of this. Please, if you are not aware, you can also please make out time to participate. Look out in your offices, look out for our letters, and help us support us to push for this event. You can make recommendation of personalities. To also be awarded the honorary fellowship and for fellowship awards. And of course, you can also assign some corporate delegates to also be there to participate. It is open for everyone.